Time being, I don't know, 6:02. We'll call the Board of Health meeting to order. All members are present with the exception of Jason Harris. Would everyone please stand and join me in the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And you may be seated. The first item on our agenda are announcements from the Health Department. This time, I'll turn it over to the Health Department.
I got a few. First, flu and COVID boosters are ongoing. You can sign up online for appointments, either through the town website or our Facebook page, or you can call if you're not, savvy on the computer. For people who are interested in the COVID boosters, we just asked that you give us a call. We're going to order less of those so that we don't end up with the big surplus, so we'll sort of do it as demanded. Our trash education program is ongoing. Just a reminder to people that if you receive a sticker on your trash or recycling barrel, it's not a citation or a ticket. It is informational to help people comply with the town's existing trash regulations and in an ongoing effort to reduce our tonnage of trash. On that subject, the compost site is currently open Tuesday, Wednesday, and Thursdays 1 to 4 for yard waste only. And just an update, because I can't remember if I updated the board or not. Terranosa, they applied for variance for their HACCP plan for reduced oxygen packaging. That plan was approved. I went in and did an inspection of the equipment, watched the employees use it, and we have a copy of their labels on file. So they are up and running. And if anyone has questions on the plan or the labeling, we have copies of everything in the office. And that's all I have for announcements.
You feel good about it? All the ducks are in a row for them?
Yep.
I might like to look at the plan if it's a matter of public record.
Yeah, sure. And I know I just see that, is it MOA? One of the state agencies is offering a Zoom session upcoming in December specifically on reduced oxygen packaging. So if anybody's
timely.
interested in that, yeah.
Is there a deadline for when is it just this week you're doing the Tuesday, Wednesday, Thursday at the?
As long as we can have it staffed, so it'll be ongoing.
Okay, is that volunteers or you having staff?
Eddie is usually there on Tuesdays and Thursdays, and then we have a volunteer in on Wednesday.
Mm-hmm. But we would not turn away any more volunteers, right?
Absolutely, and the swap shop will not be open because we don't have separate volunteers for that. So,
perfect. So, if you want to volunteer, be sure to the Health Department for the 4 people that watch at home. All right. Any other questions? No? Perfect. Moving on to our discussion action items. So, first item is a discussion of the new NEHA, or NEHA, I believe is the way we pronounce it phonetically, model body art regulations. Every member of the board should have a copy of those. Chris, I assume you're going to cover?
Yeah, Eddie wasn't able to be with us this evening. So basically, when Massachusetts legalized body art in, it was 2000 or 2001, the state decided that it wasn't going to regulate it at the state level. They're leaving it up to local boards of health. So one of the health associations came up with model regs, which we've been using. Most towns in Abington, most towns in Massachusetts have adopted the state's model regs. Some don't regulate body art at all. And across the country, it's pretty consistent like that. Some states regulate it, some don't. Some states regulate it locally, others don't. So NEHA, which is the National Environmental Health Association, put together a committee made up of regulators and body art artists and developed this body art model code. What they're hoping for is national acceptance. I think I sent everybody a link to the website. They have an annex. Yes.
Yeah,
Oh
I didn't
my
get a
gosh, I
chance
went
to
down
look
the
at it
rabbit
yet.
hole.
Yeah. So the regs themselves are like 41 pages. The annex, which has justifications for all their regulations, is like 300 pages. They have an adoption toolkit. The one thing that they don't have, and I'm happy to report that Eddie is now on this national committee. I asked him to go back and have them write up a model inspection form. We have software that we use for body art inspections, but it's based off of Massachusetts, current model regs.
Now, do they still do those spore things? They do a lot of biological chemical testings with spores and spore counts and,
So our shops in town, we currently have 5 body art shops. Only one of them uses an autoclave. Everybody
Okay.
else uses disposable equipment.
all right,
The only one that is using an autoclave is LL Browse, which is microblading. But that's one of the things that this addresses.
yeah.
Basically, any pigmentation put under the skin is considered tattooing or body art. That's the way these regulations approach it, rather than separating out microblading. Or the newest thing I just read about today is ink-free tattooing. They use a serum instead of pigment. It's used to disguise stretch marks and scars.
Oh,
Never heard about it until today.
Oh, me neither.
That's probably gonna be the next thing.
Oh.
So that's basically what we have here. So my idea with putting this before the board now is to give you, at your leisure, the time to look at the regulations.
yeah.
I have already provided a copy to all of our body art shops in town and asked them if they had feedback. I said, at some point, the board's gonna deliberate it. I'd love for them to come and discuss as well.
Yeah, how many body art do we have?
So we have 5. We have Red Elk, Skin Deep, Tiger Shark. The newest one is Blood Ink and Tears, and then LL Browse, which is the microblading.
Okay.
What's their initial input so far?
I
Or is it
haven't,
too early?
I haven't heard.
They just got it.
Most of them were very excited to hear that microblading is being considered body art and not
Yeah.
separate or distinct.
Yeah,
Hmm.
I like
Um,
the idea of it.
So, one of the things it says in here, and you may understand why I'm asking the question, if not, I'll explain, but body artist must demonstrate knowledge of this code and its intent through its completion of an examination given and approved by the department with a passing grade of 70% or higher, obtained prior to issuance of the license. Remember, we had the education issue before, where there's no training available?
Yep.
Is this national committee gonna create this examination as a model?
Oh.
And if not, can
Hopefully.
we ask that question?
Yeah, that's the other thing we'll go,
Yeah.
it's, one of the nice things is having Eddie on the committee, so
Yeah.
that we have a voice.
Yeah,
That would be the other thing that we'll ask for.
Yeah.
Um,
Because, and it talked somewhere about training, and that all certificates would have names of individuals and dates and things. What training certificates
Yeah.
and things. So I don't want to run into that issue we had before, where we're going to require training, but then not have a training.
Yeah, one of the ones that, and I don't think it's NEHA that has it, but they helped develop it, is the bloodborne pathogen training, which I took. If you don't know anything about bloodborne pathogens, it's an excellent training. If you do know anything about bloodborne pathogens, it's one of the most horrifically painful trainings you can sit through. It was 4 hours, I did it. But yeah, as far as testing for the license, yeah, that's something they would be developing.
Yeah, I guess I just, if they have it already,
Yeah.
then awesome, but,
The nice thing about the intention behind these model codes too is if Abington decided to adopt them, you could do it entirely, everything here. You could cherry pick stuff that you want. You could add or delete. Where we're not regulated at the state level, there's a lot of leeway as to, what the towns want to do. This also covers braiding, scarification, and branding. If we, as a town or a board, you as a board decide you didn't want to allow braiding or branding or scarification, you could exclude those.
it's
It's all up
not
to
really
you.
applicable, because none of the facilities now do that, right?
They don't currently, but we used to not have marijuana shops in town either, so,
Yep.
They may come a day.
Okay, so the idea for now is to continue to peruse them, see what kind of feedback we get from our 5 shops, invite them to a kind of a discussion, and then make sure that we get the info on if they're gonna have the trainings, because if we're gonna demand it, we have to have it, and then go
Yep.
from there. I like it.
yeah.
I
and
thought
that-
it was awesome. There were
'cause-
some really cool things in there
Yeah.
that I hadn't really thought of that aren't even applicable to nursing. Like, tattoo artists can't wear any kind of bracelets or rings or jewelry or have nail polish, like long nail polish. Like, they're strict.
Yeah,
I've
and-
never had to take off my rings as a nurse.
Well, like my question too with the examinations, like, I guess we could omit that as well as a requirement, but,
Right.
Yeah.
it's not like this is something we can blindly
No.
accept, so.
Yeah, and I would presume if NEHA wasn't going to develop it themselves, we have enough subject matter experts around that we could put something together if we wanted to.
Yeah, I know it's part of the conversation. I personally believe there should be some sort of training or some sort of evidence of training available, and I'm sure half of our, or all of our body artists have gone through some sort of training or apprenticeship, but
Yeah.
proof of that, I think, is at least a fair thing, and especially some of the more important parts of that. So if we have something of evidence of that, I think that just makes consumer confidence and our confidence
Yep.
in their ability to do so better. So, all right, so we'll kind of keep this, I guess, as a rolling agenda item, just with, you know, any updates. If there isn't, then we'll just, you know, kind of peruse past it, but at least it's something we can keep moving on. Questions, thoughts, concerns, idiosyncrasies, oxymorons, automatopoeias? Perfect. All right, we'll move on to the minutes of October 21st. Everybody should have a copy of those. Do I have any action on that?
I will make a motion to approve the minutes from October 21st.
Motion to approve by Katie. Is there a second?
There'll be a second for
Sec-
me.
Second from Susan. Any further discussion? All in favor?
Aye.
Opposed? And approved. Right,
Yep.
moving on. Health agent report. Chris?
All right, so we had 2 inspections, actually I did these today, A&D Gas and Abington Stop and Shop. There were no priority violations issued since the last Board of Health meeting. For complaints, I think I mentioned the mouse complaint at 585 Chestnut. I did an inspection, received a second complaint from residents. And so it's a difficult issue. It's a big building, there are mice in the building, and the mice are in the walls. The company currently has a pest control company coming in and baiting and trapping mice in the building, and then the maintenance department is sealing up the units one by one as they get complaints. So part of the issue is some of the residents are complaining to us, but not building management. Sometimes they seal up an apartment and the mice are in it when it gets sealed, so then they see them. So I did write a correction order, ordering the management to get a pest control company. They are doing that. So it's open, I'm working with them, but they are doing what they are required to do by the state statute, so.
The hard thing about rodents is so much easier to prevent than to get rid of them once they're there. It's
Yeah.
hard.
Once
It's
they're
ha-
in.
It's a harder job.
Yeah.
And the consequences, you know, what you have to do to get rid of them is a lot worse.
Yeah, the good thing is the 2 units that I inspected, I didn't find any urine trails, I didn't find any droppings, so it looks like the
That's
infestation, they're coming out into the apartments, but they're not living in the apartments from what I could, the 2 units that I inspected.
Is there any speculation of what's driving them?
They got into the building at some
Yeah.
point, and,
It's
I
not, you
liked
know,
it.
active construction anywhere or anything like that.
no.
Just increase, it's just normal, yeah.
Yeah, they were concerned about rats, and I told them the good thing about it is if they do get rats, it'll scare the mice away, but.
Yeah.
that- so, Also received a complaint about unsanitary conditions at Angel Neurological. I referred the complaint into the state because we don't oversee that, that's a medical office, so complaints need to go to the state.
What was the?
They said it's disgusting, dirty, whatnot, so. And then we received a complaint today. Actually, we received a couple of complaints over the last few weeks, and then I got another one today of sewage backing up at 292 Bedford Street. The occupants said when they flush the toilet, it's bubbling up through the bathtub. So I went over today, did a visual inspection of the property, and I could see that the septic tanks, the access holes are cracked and open. You can actually peer into the tank. There was a smell of sewage.
That's,
So I came back and I wrote a correction order ordering them to have a Title V inspection because the system was put in 1969 and I have no inspection on file since then. So if I was asked to take a guess, the system will probably be found in failure.
Yeah.
But I gave them 14 days to have an inspection done. I did talk to the management company today. They are doing that, and they had a septic hauler over today pumping the tank out today. So we will stay on top of that and keep you appraised of the outcome. And then training conference, haven't had any in the last couple of weeks. Oh, I'm sorry, I did have a 2-day one last week. Social media tools and techniques. That was a FEMA course. It was a follow-up to one he had taken earlier. Next week, I'll be attending the Mass Health Officers Association Annual Conference in lovely Springfield. And this Thursday, we'll be attending a seminar in Plymouth on rat explosion, not literally rats blowing up, but the explosion of rat populations
Oh,
in Massachusetts. It's being
Scare the
put on,
mice away.
being put on by a pest control company. And that's it.
Any questions, comments? No. Perfect. Okay. Public comment?
I do have a comment.
Oh, go ahead.
Ellen Delaney, 18 Washington Street. I was wondering if you're going to offer CPR courses.
Sure. We have 3 certified instructors in the department. It's really just a matter of time and interest, so I will mention that to Lindsay and see if we can
Thank you.
put some
I
feelers
haven't
out.
had it
To
in
re-up
about
too.
12 years, so.
I just did one. They did one with the Medical Reserve Corps in Randolph.
Cool.
Yeah.
Thank you.
Is it Red Cross, Heart Association?
Yeah, Red Cross, first aid, CPR, AED training we can offer.
Beautiful. Well, that was it. Okay. Did you have any other comments?
No, it's
Perfect. Okay.
Thank you.
Correspondence? Anybody have any correspondence to share?
I've had multiple families expressed interest in a course that's being offered in Rockland. Chris, I mentioned it to you, I think last week or the week before. I still haven't reached out to them yet. It's on my to-do list. But it is a stay-alone, like, instructional class for kids grade 5 and up, I believe. But there's a woman who runs it out of Rockland, and I want to reach out and see if she'll offer it here in Abington, because I have a kid that age, and I think a lot of my mom friends also have kids that age, and I'd love to set it up. So I'm going to,
Sounds good.
yeah, right? What to do if you have
Yeah.
an emergency, how to stay safe when you're home
Sure.
alone. Yeah.
I remember, I think they ran a course like that here when I was in high school at one point, so they definitely.
I wonder if it's
not-
the
I'm
same
not-
person.
Yeah, they
Yeah.
used to do a dare officer used to do stuff
Yeah.
like that too.
Yeah.
Because it's,
Well, no, it's important.
Yep.
yeah, it is
Keeps people
important.
healthy, safe.
Yes, public safety, public health.
Keep those, what was the name of the bandits in Home Alone?
The sticky bandits?
The sticky bandit, or the wet bandits?
They
Yeah.
changed.
Yeah. Keep them out.
Yeah. That's next month. Any other correspondence to share? No? All right. With that, that's the end of our agenda. Do I have a motion to
I will
adjourn?
make a motion to adjourn.
I'll
Motion to
second.
adjourn, second, from Katie, second from Susan. All in favor?
Aye.
Opposed? We are adjourned.